Good evening, and thank you very much for joining us at this late hour. For those of you who haven't met me yet, I'm Natasha Tsopardi-Muscat, Director of Country Health Policies and Systems from the WHO Regional Office in Copenhagen. And it's truly a pleasure for me to be moderating this session this evening, a historical session, I would say, for the Gastein Forum. And thank you, Gastein, for hosting this session, Health in a Time of War, Reforms, Resilience and Recovery in Ukraine. And we are really grateful to all our Ukrainian colleagues and friends who have taken a long journey to be here with us in Gastein. So why did we put this workshop session together? What did we want to achieve? We first want to make sure that we leave everyone with a very clear impression, image, factual information about the situation on the ground in Ukraine. But not only the war, but also what is happening in terms of health system development and recovery, which was already started in the early weeks in 2022. Secondly, we want to hear the voices of the people of Ukraine, not to hear it secondhand from myself or others who have visited Ukraine, but to hear it from the Ukrainians themselves. And third, perhaps it may seem surprising, I think that there are many lessons for many of us to learn from Ukraine. So let's kick off the session. There will be interpretation, so make sure that you plug in and you choose 1 for English, 2 for Ukrainian. Thank you very much. And we will also have an interactive Slido session. And we have Katerina from the Angersteiners also with the newsroom over here. So with that, I would like to start off by introducing our guest of honor this evening, the Minister of Health, Dr. Viktor Liashko. The floor is yours, and we will also call for the video to be played, and when you want, you can come and deliver your keynote. So let's have the video.
I will speak Ukrainian. Сьогодні на форумі ми говоримо про демократію. Але не можна говорити про
It's impossible to speak about democracy
тоді, коли
when
в Європі
in Europe there is a tyrant
і робить те,
who
що ви бачили
does
тільки що
what you have just seen on this video.
Сьогодні ви на
Today, at this forum, we are speaking about demography. But whether it's possible to plan a better demographic situation if at any time during a day you can be a peaceful town can be hit by rockets, as you have just seen. 7 million people left Ukraine. Approximately 20% of people have to move around Ukraine in order to find a safer place. Approximately 60,000 children were born in bomb shelters during these 2.5 years. They were born because their mothers wanted to save their own life and their life. And they wanted that they start their life in this world in a hope for a better life. About 200 healthcare workers, civil healthcare workers, were killed from the Russian terrorists. On this picture, you can see the place where a young physician started to work. And he worked just 3 days. On the third day, he was killed by Russian terrorists. Shortly, in Kharkiv, a medical student was killed. In his free time, he was helping with a medical emergency team. These are all realities under which Ukraine works. In my speech, I would like to address everybody and to say thank you for the support which Ukraine has been receiving from the full-scale invasion by the Russian Federation to our territory. Currently, about 700 medical staff from the European Union came to Ukraine, and they work shoulder on shoulder with Ukrainian specialists. 70 organizations help us to make our medical system better. And for that reason, I'm thankful to everybody who is with us and who helps the Ukrainian system.
At the moment, you can see the picture where you can see the number of the evacuated within the program MedEvac, which is implemented together with the European Commission and the WHO. It is the picture where you can see the numbers of the accepted patients or injured persons who suffered from the Russian terrorists in Ukraine. This picture is not showing the number or the amount of help and support from other countries of the European Union and who accepted 7 million refugees from Ukraine who were forced to be displaced. It is enormous work, and it is also a sign of solidarity of the world community in order to provide the universal provision of health services, also for people who are living their country because of the crisis in their own country. The Ukrainian system, despite all the situation, the whole situation is still developing. You can see another slide with the information data with small circles, and these circles are the attacks on the health facility and medical infrastructure in Ukraine. You can see that there is no region in Ukraine where the Russian missiles or projectiles or weapons would damage a medical facility. Over 1,800 objects, these are buildings, the whole hospitals or parts of the hospitals were damaged by the attacks of the Russian terrorists. 216 healthcare facilities were destroyed in such a way that it is not possible to rebuild them again. We have to build new healthcare facilities here in these places in order to provide the medical services, the healthcare services for our population. If we would calculate the loss for our infrastructure, we would need $7 billion in order to rebuild and to recover Ukraine and the infrastructure and to reach the state which we had before 2022. These all are challenges, and we have to live with these challenges at the moment. But not only the hospitals are damaged and destroyed, but also pharmacies suffer under Russian attacks. You can see again the numbers of the destroyed and damaged pharmacies in Ukraine. If we have such numbers, but still we have to be creative to find ideas how to guarantee the access of our population to the medicines. You can see here also the picture of the first mobile pharmacy point, which is
у визначений час і дозволяє людям прийти і отримати ліки, які життєво важливі. Життєво важливими ліками можуть бути інсуліни.
Life-saving medicine. It can be insulin, for example, or it can be hypertension medicines. It can be hormones which allow people to live and to hope that they are going to have a future. That's probably from outside. You can think it's not a crisis, but still, if in the martial law, in times of war, it is very important to have something like that and have the medicines for which can save your life. In the first weeks of the war, as the tanks came to Ukraine, onto Ukrainian territory, they didn't allow us to provide any supplies with medicines to people who were forced to stay in the occupied territory. I had also cases when we had some drugs had to bring to the north coast of the river Dnipro, if it was not possible to go by car over the bridge or to go with an ambulance vehicle, and we could not use any other routes, so we had to find another ways to provide the necessary medicines. The access to the emergency help in Ukraine. Each fifth ambulance vehicle which was in Ukraine and which was used for the emergency cases to respond on the calls was stolen, damaged, destroyed, or seized. Each fifth vehicle. If we consider the targeted attacks on our energy infrastructure and system and on telecommunications and disruptions in telecommunications, when people are not even able to use the emergency number 103 in Ukraine so that the emergency could come to the place where it is needed, these all are indirect consequences of the war and the impact on our health, and we will be able to assess such things only later in a longer period of time. Approximately 8% of the health workers are working today is not in the workplace which they had before, because the health facilities are damaged or destroyed, because the front line is getting nearer to them, or because the Minister of Health is addressing these people and with the request to leave their families, to leave their teams, and to go to help into the settlements where the help is critical and where is this needed. The neurosurgeon has to go to Kherson and to do the surgery there, because it is not possible to bring a patient from Kherson to Kiev. We have a lot of such cases, and it is a permanent work which we do, so that we cannot plan strategically, and it forces us to work tactically at any point of time in order to responding on different situations which we face. But the Minister of Health is not stopping. The country is not stopping. We have on one side the challenges, but we also think about our future. You can here see, for example, the registry which we have in Ukraine, where we are planning the staffing or these healthcare workers who have to come and who are ready to work in the liberated territories, and we hope to liberate these territories. You can also see here the Autonomous Republic of Crimea, and we have already people who are ready to go there and to start their work there, and to start to work in such territories. At the same time, the war brings further challenges, and we are responding with double force and efforts on such challenges. One of the challenges which I'm talking about, and I will talk about it, that we have not only the physical injuries, but we also have the mental health of persons. It is not allowed to think about this later. We have to think about it also at the same time when we are treating the physical injuries, because later, if we do not consider the mental health, we are going to have a big problem with this situation, with such disorders. And now you can see the numbers, how the number of people increase who needed the mental help and mental treatment already within the first weeks of the war. As you know, we just believe we know the strategies which are used in such monopsychiatric facilities, but all such facilities are loaded by patients with acute status, with acute states. It is a program. It is also we have also a program of mental health, which is supported by the First Lady in Ukraine. These are the numbers which we are calculating together with our office of WHO in Ukraine. These are the numbers of people who need the help with their mental health. But if you take some approximate numbers, we can say that almost 90% of Ukrainians need some help with their mental health. Another topic is the dynamics of the prosthesis of the higher or lower limbs. The dynamics has been changed a little bit. I do not show here the number of amputation which is done in Ukraine at the moment, but we can see only the prosthetics which is done at the moment. But during the war, in time of war, sometimes you need 5 or 10 re-amputation in order to reach the result you need, because the amputation are done at the front line, also done at some temporary points, and they do not think about the final result of the amputation. So several re-amputation can be necessary, and the numbers of re-amputation are increasing very significantly, and the system has to be ready to respond to something like that. And if the system is not ready for such challenges, then you have to adapt the system very fast. It was one of the challenges we had at the very beginning of the war, but thanks to the international help and support, we had big advances in this field. After such cases, such issues, you need a different rehabilitation. You have challenges also for the rehabilitation. If we are speaking about the reforms which were implemented in Ukraine in the healthcare field, you can see the hospitals in Ukraine. They are marked by yellow, and these are hospitals with rehabilitation teams. Multidisciplinary teams are working there with the necessary physicians and physiotherapists who allow to bring the person back, to rehabilitate the person, to give the person their health again back. And in case of amputation, they show how to use a prosthesis, not to reject a prosthesis. And the key thing which we could change and which we can see in Ukraine, it is the attitude of persons to attitude of the person who has a prosthesis. It is now not a disabled person. It is at the moment a super person, a superhuman. And today I can say, and I'm sure that most of our soldiers who have prosthesis are proud of their prosthesis, and the Ukrainian population is proud of people who have prosthesis. We have much more challenges, but for example, we need the barrier-free access in buildings. These are not medical probably issues, but still the medicine has to think also about such issues like barrier-free access of people with prosthesis. So if we speak about the development of the healthcare system in Ukraine, and if you ask us whether we have a development, yes, we have such development. You can see here the numbers of the developments in Ukraine. So at the same time, concurrently with the military medicine, we have also some innovations in Ukraine, and that is implemented at the same time that in the field of the transplantation, it is not allowed in Ukraine to use the transplants of persons if somebody is died at the front line and there are some injuries from projectiles and bullets. But still, even in this situation, we continue to use innovative technologies and innovative equipment, and we find the ways how to supply Ukraine with the necessary supplies which we need. The enemy is unfortunately attacking and damaging the hospitals in Ukraine and the infrastructure, but still we do not say that we are not ready to use the innovations in Ukraine. We still use innovations, and the key thing is to have hope in our medical workers, and that they have the hope, because the healthcare system is dependent on them, and it can be only resilient if they have this hope. If we speak about the hope, then we speak about the accession to the European Union by Ukraine. It is another topic where Ukraine is working on, so that Ukraine can implement all the necessary directives in the Ukrainian legislation, which is necessary to be done by the member state of the European Union. You can also see the international medical partnership which was started, and we have already results in this field. We can compare the hospitals in Ukraine and in the European Union. They cooperate with each other, and they are helping each other, giving recommendations and supporting each other, so that we always have a result of this work. At the end of my speech,
please use your voice in order that we can bring back from the captivity to bring from captivity Ukrainian medical workforce, which Russian Federation took as prisoners of war, and from whom they withhold visits and controls. UNICEF, UN, no other international organization can visit these captives. Russia is a terrorist state, and you may not uphold relationships with Russia until Russia has left Ukrainian territory.
I'm sure that you must have all found this not only informative but absolutely touching. Thank you so much for being here and for sharing so openly. And now I would like to introduce the panelists for the first panel. So I would like to introduce Dr. Jarno Habit, who is our WHO representative heading the country office in Ukraine. I would also like to ask to come to the stage Miss Ina Ivanenko, who is the executive director of the Patients Association in Ukraine. And I'm not sure whether we also already have, yes, we have online. We just can't see him yet on the big screen. Thank you so much to the governor of Zaporizhzhia Oblast, Ivan Fedorov. So let's focus a little bit more, let's dig a bit deeper in the challenges that we have heard spoken about. And perhaps I can start with you, Jarno. After seeing these pictures of everything that is happening, if I can ask you, there's just so much to be done. Where do we start from? What should be the priorities for the international assistance to help the Ukrainian healthcare system to continue to deliver and to accelerate the recovery?
Thank you. And thank you everybody here in the room. We are many here. And greetings for everybody who is following us also online. So great to have this discussion about Ukraine, about healthcare workers, about health systems in this meeting. As Natasha, you said, there are many priorities. And we saw the presentation from Victor with many pictures with the devastation and disruption, but also, I would say, hope. And I think first takeaway for me is to go deeper and understand this concept that in Ukraine, the response, recovery, and the reform is happening at the same time. It's very simple. If I should finish now, that would be my main message, because it is difficult sometimes to comprehend that you can develop something new while the war is ongoing. But this we have witnessed 946 days. This is exactly the number of days since 24th of February 2022 and Russian Federation invasion. And we hear more from Ukraine colleagues about that. The second, we need to think how we finance that support. We see that the humanitarian support to reach 3.8 million people in 2024 is $145 million. But already the recovery needs, which is calculated by the UN system, the World Bank, European Union, everybody working together, only the recovery needs for 2024 is $873 million. So that means that the recovery needs, just put in monetary value, and we don't talk here even about the healthcare workers, is 6 times bigger. And we as international community need to think how we finance that through the budget support, through investments, through partnerships. And that needs to be financed, because otherwise we have a risk that we leave Ukraine behind. So we need to figure out the financing. The third is to find the courage to continuously support Ukraine and to be in Ukraine. I have seen many in Ukraine, and as Minister was mentioning, many are coming to support, but it needs courage because it is the 3rd year of war. We are getting ready for a very cold winter. It's complex, but that courage needs to be also not only among Ukrainians, but also those who are outside. So these would be the 3 things really to take: the complexity, but recovery starts on the first days of war. Finding financial resources now, which is very, very important because humanitarian funding is decreasing and the recovery reconstruction funding for many starts at the end of the war, but Ukrainians can't wait. And the third, for everybody who is following, to find a bit more courage and to find a way, because even every small step you do, even if you call to your colleague in Ukraine, helps. Thank you.
Thank you, Jarno, and thank you for really holding the fort there. leading the country office in very, very difficult circumstances. I mean, I visit for a few days and I always marvel at how my colleagues, there are others here in the room, have been working for all these weeks, 946 days in these circumstances. And very clear messages. Governor Fedorov, Zaporizhzhia is very often in the news, sometimes for very sad reasons. We thank you for taking the time to be with us here online. And one of the things, I suppose, which you struggle with on a daily basis is ensuring that you have the medical supplies and the equipment you need in the most affected areas. So perhaps you can tell us a little bit about how on a daily basis you are really ensuring that the medical supplies, equipment, human resources reach those most affected areas.
Dear colleagues, are you hear me?
Yes, yes.
I try to share my presentation. Is it possible?
Yes, we see it.
Dear Minister, dear colleagues, dear representatives of the World Health Organization, dear participants, it's a great opportunity for me, and thank you for inviting to share and to give us more information about what is very important for our citizens. When you ask what our insurance, I have very simple answer. Now our citizens which stay on 20 kilometers from front line need care. And one of the main care which they need, it's of course medical care. For better understanding in what situation we now, and my office from 30 kilometers from front line, 70% of territory of the Zaporizhzhia region now fully occupied by Russian troops. On temporarily occupied territories stay more than 300,000 of our citizens. And of course, some of our medical staff also need to stay on temporarily occupied territories because they have displaced relatives, because they have old parents, and other reasons. For better understanding, more than 14,000 buildings and houses destroyed. Also, hundreds of medical care buildings fully destroyed by Russian troops. And one of the biggest our challenge which we feel on Zaporizhzhia region, which controlled by government of Ukraine, it's more than 200,000 IDPs which stay in Zaporizhzhia region. Also, of course, it is very important to understand in what condition we work every day. Until from 5 till 7 hours per day, we heard air alarms. And of course, it is a very greatest challenge for us. For better understanding what does it mean healthcare facilities in the Zaporizhzhia region. For reference, in the part of the Zaporizhzhia region under Ukrainian control, 65 healthcare institutions are operating. Medical care is provided in all directions: emergency medical care, primary medical care, specialized medical care, palliative care, and other kinds. Of course, we understand that we from 20 kilometers from front line, but it's amazing. But several months ago, in our regional hospital, we have transplantation of heart in our clinic. That's why our medical staff and our doctors make amazing things. Of course, we have challenges. And what are our main challenges? For more than 2 years since Russian full-scale invasions of Ukraine, we have been facing new challenges. The main one is preparing our hospital for emergency situation. We must understand that in Zaporizhzhia and our communities, emergency happen every day due to the occupiers, because enemy shelling doesn't stop for a science a day. For better understanding, from Monday until today night, Russian shooting to middle of Zaporizhzhia city more than 20 times. Russian killed 1 civilian citizens. Russian wounded more than 30 civilian citizens. Every day, Russian shoot to frontline cities and villages more than 300 times per day. That's why, of course, one of the main our problem is personnel aspect. Since the introduction of material law, about 30% of the medical persons have left the region or gone abroad. More than 400 healthcare workers displaced from the temporarily occupied territories have been employed to the Zaporizhia Regional Healthcare Institution under Ukrainian control. Thus, the migration of medical workers and their mobilization into the armed forces of Ukraine affairs the shutting of healthcare facilities. Of course, we have lack of specialists, and one of the main lack is different kinds of surgeons, anesthesiologists, and other kind of very short specialists. Due to the increased demand for the rehabilitation services, there is a need to retrain doctors from the various specialties into physical and rehabilitation medical care. Also for better understanding, we of course have one of the fear. It is psychological aspect. What does it mean? All our citizens, also doctors, fear of their future. Nobody knows. If they sleep today, is yesterday, is tomorrow, they can wake up. Also, our IDPs have a fear because when they left from temporarily occupied territories, they left all their life. They lose all their life. And it is the most of the most important challenges. Of course, material and financial aspect. Since the beginning of the full-scale invasion, 48 medical facilities in the region have been damaged and 8 destroyed. But we have no another opportunity. We need to rebuild and repair all our facilities. Of course, now we change a kind of medical care for our citizens. For example, in Zaporizhia region, one of the biggest hospital, city emergency and urgent medical care hospital. The hospital main profile is surgical care. Over the past 2.5 years, before Russian military full invasion to Ukraine, in 2021, main task from hospital, it was some traumas and absolutely regular things. But while in 2023 and 2024, we have 41% more patients with suffer from mean explosive injectives. Of course, the same situation we have in child hospitals. And we understand that day after day, we will see more wounded citizens, and we need to be ready for it. Of course, one of the main tasks for us, it's organization of medical service. I can give also numbers. On 2021, we have 55,000 surgeons. On 2023, it is more than 68 increase. It is more than 25% more as before full invasion. Of course, now we have one more challenge. We need to be prepared for blackout. And it is not regularly reserve generators as we ready and as we prepared. Because regular generators can work 4 or 8 hours. But we now need to be ready to work without electricity 3, 2, 4 days. Nobody knows. That's why we need to be ready. And of course, we need to be ready to give very comfortable and on-time medical care. Yesterday, Russians shot to our civilian buildings. 30 citizens was wounded. 30 citizens was delivered to our hospitals, and 30 citizens take good quality medical care. But now, as Minister Leshko said, we can't stay and wait something. We need to make best infrastructure for our citizens and, of course, best conditions of work for our doctors. And one of the main tasks which we see for ourselves is to make regional center of medical rehabilitation. Why it is important? Of course, we have one of the most important category, it's our soldiers, which was wounded. But also we need to understand that all our citizens which now stay in Zaporizhzhia region have greatest problem with mental health, because we have stress 24 hours per day, and they also need rehabilitation. That's why our task in the nearest future make one of the best rehabilitation center in south of our country. Next, our task, which we see for us, it's medical care for children. Of course, we understand that quantity of children and of youth on frontline region start to be less every day. But now in Zaporizhzhia region, we have more than 50,000 only those children who go to school. That's why we need to give a greatest medical care for our children and for our youth. That's why we want to implement project to build a special surgery unit for our regional children's hospital. And last but not least, we have very important project, which this clinic start to be main clinic for last 2.5 years in Zaporizhzhia region. Tens of thousands wooden citizens come to this hospital. And we understand that this hospital need to be in a good condition. And 2 months ago, we start repairing these hospitals, and we have very ambitious goal. After next 6 months, we need to rebuild all of it. We need to find opportunity to put new units and new medical equipment to this unit. And after 6 months, open doors for new generation of medical care in our region. Why we not stop? Because we need to show and our medical staff and our doctors, and what is very important, to our citizens, that we will make care for them and they can trust us. Thank you very much. Thank you for opportunity to be with you today.
Thank you very much, Governor Fedorov, for sharing again this narrative of what is happening, and we wish you all the best with, of course, all your plans and projects. And just listening to Governor Fedorov, I mean, I think all of us must be thinking about the resilience that him, his team, all the healthcare workers are demonstrating. But I'm always struck by the resilience that all the Ukrainian people are demonstrating. And perhaps I would like to ask you, Inna, we've been talking a lot about social participation, but what does it mean, social participation and resilience, for a patient organization in time of war?
Good evening, everybody. Maybe I will start from the story of one Ukrainian couple in a time of war. Olga is 24 only, and her husband, military servant, now prisoner of war, was captured 2 years ago. Olga has cancer 4th stage. She is fighting 2 battles. One battle to liberate her beloved husband, and the other against her cancer. She says that she has no right to die because then no one will fight to liberate her husband. I am a representative of a patient-driven organization, and our primary task is to stand for such patients and to advocate for their treatment rights. Maybe it is not obvious, and maybe you will be surprised, but Ukrainians do not want to leave Ukraine. They want to stay in Ukraine, and even when they become patients, they want to receive medical care at home, because there is their family, their relatives, and all their supporters are in Ukraine. We feel, of course, huge gratitude to all European countries who host at the moment 7 million of Ukrainians and treat our people from the very beginning of the full-scale invasion till now. But at the same time, we understand that such patients as Olga will never leave Ukraine seeking for access to treatment abroad. That's why it is very important to invest into Ukrainian healthcare system. And actually, from the point of view of civil society organization, I can assure you that our system has made a great progress. It survived during the war, and it is being developing at the moment. Ukrainian patients, as you already see, have access to medications. We have Ukrainian NHS, which pays hospitals according to the contracts. We monitor all obstacles which patients face and discuss with the Ministry of Health and find sustainable solution how to resolve patients' problems. And according to the studies of patient cancer organization, the number of patients which received medical services and treatment free of charge increased twice during since 2022. Ukrainian civil society organizations are famous for their watchdog function and zero tolerance to corruption. Despite some political intentions to put on hold the healthcare reform, even through the Constitutional Court, but each and every time civil society organizations unite and defend healthcare reform. Because we strongly believe that such resilience and following the initial path of healthcare reform allowed the system to withstand the biggest threat ever, the full-scale war. Also being aware that health sector is funded by our partners, we feel high level of responsibility to both partners and patients. That is why we introduce corporate governance into the hospitals. We have numerous patient representatives in the Public Control Council of Ukrainian NHS. And I personally undertook a chair role in Oversight Council for the reconstruction of Okhmadit. It's the biggest children's hospital in Ukraine, which was severely damaged by Russians this summer. And you saw this on the video at the beginning of the session. Our job is to ensure that all funds are used transparently, effectively, and in line with patients' interests.
Thank you so much for really shining a new dimension on social participation at the time of war, but also for illustrating very clearly that reform is ongoing, change and transformation is ongoing, and that policies to increase access, to increase quality, to innovate are taking place even under these very difficult conditions. And thank you also for highlighting the important role that civil society plays in holding government to account. So to close this first panel, because we are running somewhat over time, I would like to turn to you, Minister Liashko, for any concluding remarks that you would like to leave with the audience in terms of your priorities.
Thank you very much for the question. Thank you very much to my colleagues for your speeches. The priorities, sometimes I have to make a sad joke in the Ministry of Health. So the priorities are defined with a very short term of planning. Our strategic planning is nowadays can nowadays take for 10 hours, can be planned for 10 hours, because within 10 hours the situation can be changed absolutely, and we have to use our efforts in a different field. Just imagine you're a minister, you go to your office, you plan, you speak, you have some operational meetings, and in the next moment, you do not have the main pediatric hospital in the route of your patients. In the next time, you have to evacuate all children all patients who were in this hospital, and they have to continue their treatment. You have to find the institutions, the hospitals, so that they can provide all the medical services. And the new injured persons have to be brought to another hospitals, and that's the issue of support of our partners is very important. We are speaking, if we talk about the demographic situation, we also speak about the analysis of the challenges, and we have to understand why do not have such birth rates like before. We also started a new project. We started a program about the reproductive technologies in Ukraine before war, so that people who cannot get children, or to help women who cannot get pregnant, that was this program which helped such people. We are also collecting the reproductive material of persons going to the combat zones. So that's what we are doing each day, and what we do in our analysis, so that we are advancing, so we do not stop for any minute, because we understand which challenges we have in our society, and our duty is to do everything what is possible so that our people can get their medical aid at the appropriate level there where they live. For us, it is the challenge. That is the key challenge, and I'm going to repeat it many times. Do not be hallucinated that the healthcare system of any country is able to cope with the challenges of war on its own. Any healthcare system is not able to do that on its own. That's why today the main and the key task of us and of all of us is to have cooperations. It doesn't matter who exactly is going to help, but we need this help in shoulder in order to respond to the aggression which is unfortunately staying in the world. And we have to say it each time when we are developing and establishing these strategies, how to react on or respond to the pandemic. We may not forget the conflicts, military conflicts, and other catastrophes in the whole world,
which become ever often in the world and bring new challenges for the healthcare system. Without that, we would not be able to fulfill our main mission to serve those who need our help at most. Thank you.
Thank you very much. And we will indeed talk about international participation and collaboration in the second panel. But before we go to the second panel, Katerina, can you tell us perhaps what has been coming through from the newsroom?
Sure, thank you, Natasha. Actually, despite being quite late today, the audience is quite active. There is a specific interest in learning more about the reforms that Ukraine has accomplished or is undergoing, specifically in a nexus whether there were some changes or revisions of the reforms as it was implemented, and whether some reforms were cancelled or some reforms were initiated. As well as another question, and it's something that you already brought up in your interventions about the funding, where the funding, for instance, for rehabilitation is coming from, and whether EU has an opportunity to create some additional specific pool for supporting those Ukrainians that were wounded as a result of the military aggression.
So we'll talk about the EU in the second session, but perhaps, Minister, if you can briefly tell us, have the reforms been slowed, cancelled or accelerated, and give us a couple of examples? I think I know the answer.
Жодні реформи в Україні не зупинились.
No reform in Ukraine stopped.
Вони впроваджують.
Even if they are difficult, they are continued. The key reform in the healthcare system, it is the second stage. After the money followed patients to the hospitals, we pay the service in the hospitals. This started during a critical time for our country. It was in the middle of the COVID pandemic. We started this reform, and during the war, we did not stop this reform. We added digital options. We recalculated the tariffs under the conditions of war, and we increased the money for trauma services, implants, and so on. They are very costly, and for that reason, more money comes in. Acute dialysis needs more money because if tourniquets are used on the front line not correctly or later, it leads to amputations. As for rehabilitation, during the war, approximately 4 times we changed the payment for this sort of services, and depending on the difficulty, we pay depending on the number of amputations. And it is a process without end, probably. At the same time, we planned our hospitals and we started the infrastructure stage. We know the place and role of each and every hospital, and we know what function should be apportioned to this or the other hospital. At the same time, the infrastructure is ruined, and bridges are destroyed, and because of that, longer distances have to be overcome. We work with patient organizations, and we deliver what we can, and of course we want to deliver even more.
Thank you very much, and I see that Inna also would like to come in.
I can add a very important thing, important for patients, that during the wartime, Ukrainian parliament has approved a law on medical cannabis. And very soon, Ukrainian patients will have access to medications from medical cannabis. Thank you very much for this support, and thank you to the Ministry of Health for all the work you are doing that patients have this access.
Thank you very much. Please join me in giving a warm round of applause to the Minister, to the Governor, to our WHO representative, and to the representative from the Patients Organization. So I would welcome you to take a seat now. And before I ask the second round of panelists to join us, we want to ask you now, given what you have heard, what do you think is important to sustain the resilience in Ukraine? And I believe you can join the Slido, and there will be a word cloud. So just type away words and phrases, and let's see it coming up on screen. And in the meantime, as we move now to the second round of interventions, it is my pleasure to invite Marina Slobodichenko, who is the Deputy Minister responsible for EU integration. Welcome, Marina. Isabel Della Mata, representing the European Commission, that has been working very actively, of course, in Ukraine. And Maris Jesse, who is from Estonia, has been previously Secretary General and advisor to the Minister of Health. And also Estonia has been working very closely with Ukraine. Do we have anything? Can we get the word cloud on the big screen? Is it possible? Tech? Here we are. Okay, collaboration, solidarity, funds, support. Thank you. Thank you so much for joining in. I see the minister nodding, so well done, room. And now we come to our second panel, and in the second panel, it's really about focusing on the future. The minister spoke about the need to continue to have hope, optimism, and to continue to keep moving forward. And of course, EU accession is an important and optimistic process. It's a strange coincidence that Maris, Isabel, and myself go back about 25 years, when Isabel was, I think, just joining the Commission, more or less, but I remember her still as a member state expert in Madrid. And Maris and myself, when we were probably younger, like Marina, were dealing with the dossiers of EU accession for Malta and for Estonia. So, of course, we have a lot of empathy for Marina, but I mean, I can't even start to imagine. EU accession was a challenging and demanding process in a normal time. And just imagining that Ukraine is making strides also to move forward with the EU accession process whilst fighting a war, whilst investing in recovery is overwhelming. But Marina, I know that you have been working very hard, so perhaps you can give us an example of the way in which Ukraine is working with the European institutions, but also with other EU member states to build support for the accession and to carry out the reforms that are needed in laws, institutions, in the Ministry of Health.
Thank you, Natalia. I will continue speaking Ukrainian, if it's possible, and that's okay. Thank you.
Our preparation for the negotiations is very strong and very quick. On this way, we are not alone. You said it right. We cooperate with other European countries, and we are thankful to other countries for this international support and currently, there are many such countries. Bilateral cooperation with countries is really a very important component on our path to the European Union. Estland, Germany, Letland, I cannot count every country. France, these are countries who have been helping us on our way to the European Union and on our plans to implement European ECU. This cooperation has started, and we are supported by technical experts, and we receive advisory recommendations. European countries are not alone in supporting us. International organizations help us. For example, I would like to be open. WHO, who help us, and this organization is our counselor in questions which are of main importance for us currently. Teamwork of all participants of all countries is very important for us, but I would like to mention another aspect too. We in Ukraine are moving to the European Union together. I like your conference because the same values are being implemented in our country. Unity of many institutions, might organizations, business organizations, civil society, and international organizations. And with this single voice, with this single opinion and act, we aspire to start with the negotiations and to join the European Union. In June 2025, we expect to have the first screening meeting with the European Union, and we are getting ready now.
For that. And we will continue to be there as WHO to be your counselor. That was a very nice expression. Yes, I think that is what we try to do. But Isabel, you have been working with many countries preparing for EU accession. So, you know, here is Gastein, is the forum. It's late, nobody's listening. Can you give some friendly advice to Ukraine? You know, what should they focus on? How can they make sure that the process is as successful and smooth as possible, taking the context into account? And how are you helping them? I know that the European Commission is helping very much.
Yeah, I wanted to make this differentiation very clear, because there are two processes that are taking place at the same time. One is the access to the European Union, so the process of integration. And on the other side, we have the support to Ukraine, not only to the health reform, but we have been presented all the struggling numbers by Victor and also by the governor of Zaporizhia, and the many health facilities that have been destroyed, the health professionals, etc. So we need to support in that area. But at the same time is the process of accession to the European Union. And it's true also that when you, Estonia and Malta, joined the European Union, the situation was completely different. I mean, in the sense of the legislation, there were not tissues on self-directive, there were not transplantation, there were not cross-border health care. I mean, there were not a lot of things that now exist and that Ukraine will have to adapt. But this is not negative. I mean, this is good because at the same time that allows the mobility of patients in the European Union, the mobility of professionals, the mobility of students, the mobility of products. So in this process of integration of the whole European Union, there is more and more legislation. And the member states that were members of the European Union before 2004 and after 2004, they have been doing that in a regular process and on different steps. And Ukraine will have to do that in one side everything at the same time. And this, we acknowledge that that is complicated. And also, even in this screening process, I mean, the chapter is still called Public Health and Consumer Protection. Come on, we are not anymore there. It's not because, well, at that moment, well, the legislation were more public health in the sense that there are very few things about healthcare, but we keep the names, and we will have the screening process in February 2025, and we will have next month the enlargement package that will affect, I mean, 10 countries, not just Ukraine, but that when we will publish what we have been doing until now, the screenings that we have had of the legislation. And one thing that is sometimes very frustrating or difficult to accept for Ukraine and other countries, and for us to deliver this message, because it could be seen as a negative message. It's not a negative message. We say that Ukraine is progressing, is adapting the legislation, but the process is not 1%. It's all or nothing. So when you enter the European Union, all single paragraphs of all single legislation has to be incorporated in the legislation. So we can say, and I have seen 80% of the legislation. No. I know that you are not there yet. Maybe we are there in the communicable diseases, so, but we are not there in pharmaceutical yet or in other areas. So until all is adapted, you could not join the European Union. But this is a process. I mean, this is not a problem. Everybody has gone through that before. So the only thing that means is that you will need the support of the European Commission and also the member states, especially the ones that have joined. Croatia is the last one. They have the experience more recent, and they had more legislation to adapt, so that you could expect the support of everybody to adapt this legislation that is not just to copy-paste the paragraph of the legislation, is also really to introduce in your system, but at the same time that we continue everybody to be ready to support in the things that you need in the day-to-day.
Thank you so much, Isabel. And yes, indeed, on a positive note, and Gastein has had a lot of influence on this process too. The acquis in the area of health over the past 20 years has indeed changed. The landscape has changed. So Maris, now some reflections from your end. Again, you had been very much involved in the accession process. You then led the ministry shortly after Estonia became also a full member of the European Union. What do you see, if you look back a bit, as the expected challenges and benefits, and what advice would you give Ukraine?
If you let me, Natasha, I would like to start out still by saying that there are no words in my English vocabulary to voice the respect for the resilience and strengths all the Ukrainian people have, and the leadership that your president and you as the Minister of Health are giving to all of us. And the way how you look into the future is just admirable. And now, although Isabel just gave a cautionary note that at the finish line, everything needs to be there. It's not a university exam that 80% or 85% is sufficient to pass the exam. Then still, the process is gradual. It's not that all the legislation has to be adopted in 1 year. It is a gradual process. And the sooner you start, the sooner you get to the finish line. And this is the important part. Reflecting back on the Estonian experience, we were helped by several factors. Firstly, our pharmaceutical agency, the State Agency of Medicines, actually started with EU harmonization already at the time they were established in 1993. So our pharmaceutical legislation was more or less already harmonized at the time when we got the invitation to the kind of negotiations. So this is important, that the more you do every day, the quicker you get there. Now, thinking that definitely, as Natasha said, and Isabel said, the experience of the member states who acceded in 2004 and later is there. Estonia has been offering its support. We are happy that we are already cooperating in e-health, in the e-health standards, and we are ready to do more. 3 points I thought that I would like to make. Firstly, it helped to have a clear timeline with deadlines and maintaining commitment to this deadline. Although it might be tiresome at some points, government oversight over keeping the deadline is helpful. Prioritization of the legislative acts that are needed for EU accession is important. We did it a little bit, we misused it in Estonia in that sense that we started to put the asterisk that this legislative act is related to the EU accession also to those acts that were not directly related, but we just wanted to prioritize something in health. But we kind of, it was done only with a few acts. Then
say, yes, been there, done that.
So a little kind of hint for you in Ukraine as well. Definitely EU accession helped to prioritize issues that may not, in public health, that may not have been as politically attractive and perhaps understandable for the population, as chemical safety, pesticides, but which are really important and which are for the protection of our people. But yeah, political attractiveness perhaps is not at the highest of the agenda. And my last point is that the time spent on harmonization of the legislation, it is an undertaking. However, it needs, for us, in hindsight, it was a time invested in understanding the rules of the game, if I may say so, in understanding the institutional setups of EU, so that you would really be able to take the full advantage of the opportunities when you become a full member of EU. Yes, EU comes also with some limitations. The Baltic Scandinavian corner of EU is not really happy that alcohol is a good that can be transported across borders in quantities for personal consumption that definitely exceeds all risk limits. But there are some limitations and challenges. However, the opportunities are much, much bigger. Thank you.
Thank you, Maris, and thank you also for those reflections. And indeed, I think it is a very special moment. Looking back, the country can be very proud of passing through this process of building the state, of building the institutions. But again, doing so at a time of war, I think is something that no other country has really experienced. So from ourselves as WHO, from the Commission, and also from many of the member states, I am sure that you will be receiving the support that you will be asking for, and we're ready to stand by you to see this process through. And it will change the way in which the health care and public health is implemented in the country irreversibly, for the better in so many respects. Katarina, anything from the newsroom?
Yes, actually, there are a couple of questions to our distinguished speakers. First of all is what other countries can learn from Ukraine to implement fast-paced healthcare reforms? And the other question is rather how people, because it seems that there are volunteers out there that would like to support Ukraine and Ukrainian efforts in the accession process, and how they can do it.
Very good. So I think Marina, and then perhaps on the other one, Isabel, you might want to say a couple of words.
Yeah, I will start. Дякую дуже за це питання.
Thank you very much for this question.
Насправді,
really,
про реформи вже говорив міністр.
the reforms were already mentioned by the minister, and he said what are the priorities in the reforms in our country. It is very important to say that the process of our European integration cannot be stopped anymore, and the reforms which we are starting in times of war within the process of the European integration cannot be stopped anymore. They are not only they have not only the highest priority of the safety of Ukraine and among the measures which are needed for the keeping of the healthcare system, but these are the reforms which have to be implemented according to the requirements of the European Union, and we have to do our legislative system compliant with the EU legislation. These are the medical devices. It's also we are speaking about our pharmaceutical legislation in Ukraine, so that is compliant with the pharmaceutical legislation in the European Union. I'm not afraid of this word, but also probably there is not a big reform in the European Union, but we have mental health in Ukraine. It's a very important reform. It's a very important, significant reform for our country, which was implemented in our country. And these are the things which we can also share as experience. We can be also an example for other countries in the field of the mental health. For example, the rehabilitation or the military medical aid. We can be an example for other countries in responding on emergencies. And it is very important, and I thank you, the WHO, for this. Several weeks ago, there was a big mission of Latvia, Estonia, Baltic countries in our country, and they were learning from our experience how to react on threats which a country can have during the war. And another thing which I would like to mention is very important also. We are moving towards the European Union to be also helpful for other countries. For you, for representatives of other countries, you need a strong Ukraine, a non-stoppable Ukraine, a resilient Ukraine, and such a country we would like to be, and we would be in this state as a member of the European Union.
Thank you very much for those words. I don't know, Isabel, if you would like to comment on the question, how can countries help Ukraine in the accession process?
I think that the most important thing is that Ukraine knows what they need. So volunteers, I'm quite afraid sometimes of volunteers. So it has to be a request by Ukraine what they need. And Ukraine has the extraordinary support of the WHO office and Jarno, so please be organized. So don't offer, wait for the request.
Excellent advice. So basically, Isabel is saying, Jarno, let's take stock, and then with our Ukrainian counterparts, let's look and see who is best suited to provide the advice, as I think we have been doing or trying our best to do. Even before 2022, Jarno has been there since 2018, but WHO, of course, has been on the ground working in Ukraine now for decades, and there is that experience which we are ready to provide and support absolutely.
And we are supporting also through the European Union delegation, but I mean the request has to come from Ukraine.
Absolutely. So that's a very clear message. And with this, I would like to thank our three wonderful lady panelists too, and hand over now to Jarno to close the session. He was really the powerhouse behind the organization of the session, and he was kind enough to invite me to moderate. Thank you.
Thank you. And Victor always reminds me that when I start to summarize the meeting, then the meeting could extend exactly the same time plus 10 minutes. But it was very rich. And first of all, I like to thank Kashtain organizers. Minister was talking here in Kashtain in the first year since the full-scale invasion on 24th of February 2022. And now we have chance to talk 2 years later, what has happened. We have seen the pictures. And I think the organizers invited discussion around Ukraine because the democracy, demography, and digital has really put in test in Ukraine. And these 3Ds and the disruption that we saw in the presentation in the beginning is something that we need to take with us, but also with hope and what actually is happening. We heard from Victor how demography, democracy, and digital has been put in test, but we also heard about the daily realities, the work of healthcare sector, and the work of the healthcare workers, but also how many different partners are there to support. And I really like to thank everybody what's happening in the Ukraine and how you support. It was very good to hear from Ivan Fyodorov, how actually 20 kilometers from the front line, the aspiration for change, the aspiration for the reforms, the aspiration of recovery is actually the same when you are meeting people in Rivne, in Lviv, in each of the oblasts. And that's, I think, a very important takeaway, because when I was last time in Zaporozhye, we were opening and seeing the rehabilitation center. We saw the young doctors and nurses working there. That's very, very important, because the services are equally needed there as they are needed actually across whole Ukraine. And that's a very, very good reminder to us. And I really like to thank the governor of taking time, because when I have been traveling in many oblasts during the time of war, I see health is getting even more important for the governors. And one reason is because health services which are restored, the primary care centers which are opened, it actually builds the trust, the very same topic that we have discussed in Tallinn in December 2023. But that's a very essence of the trust. You can be at home, you can sleep, because you know that next morning you can go to the pharmacy, which is mobile if needed, you can go to your primary care center. And health is really in the center of every governor I have met in their thinking and work. I like to thank also the civil society. I will not open, we could have a separate conference of the role of civil society, of the role of volunteers in Ukraine. And thanks, Ina, for joining and being here. But also, I think 2 takeaways. One is the civil society is really a guardian of reforms, because they have been driving the reforms since the Revolution of Dignity in 2014, and really reminding that the reforms are important. So without civil society constantly reminding us of this, I think life would be much more boring. So I really like to thank the civil society being there, but also what Ina told us when describing the reforms is referring back to the minister's presentation, but also explaining how important role the institutions are playing. And that's another one. Without the institutions which were founded in 2016, 17, etc., and their constant work, a lot of the resilience might not be there. And these institutions under Victor's leadership play extremely important role that the reforms are moving forward. In the second round, I really like to hear that the reforms and the EU accession, they are really aligned. But it's a process. It takes further time. But also it was nice to see Isabel and Natasha and Maris reminding that actually they met 20 plus years ago talking about the same topic. And it was a little bit, they can still talk to each other. So it's a good thing. So that's very, very important because it is potential for public health, what Maris was mentioning, and it allows to really keep certain difficult topics in public health in the agenda. Victor is very proud because working 7-8 years on public health reform, at the time of war, Ukraine adopted the public health regulation, which was extremely difficult debate before. It took a war to actually adopt it, and now it is possible actually to align many aspects around public health with the EU accession as well. And as Isabel also mentioned, it's an opportunity to move ahead. And I think Marina also highlighted how important it is to learn from that process, but also the learning, what we heard just at the end, the learning which is a two-way road. So I hope to see those who are following us, not only for volunteering, but actually coming to Ukraine, learning, participating in similar meetings. We were discussing with, we should have a satellite Kashtain event in Ukraine. We are thinking about that. No obligations yet. But I really like to thank that we had this opportunity, we had this exchange, and to each of you to find a bit of courage to reflect how we can take the response, recovery, and the reform at the same time, because this is important. It's the three things. It's exactly the same way when you think about the trident. So we need to have three things at the same time always. Thank you. Дякую.